Right, the government has quietly changed the rules to allow unvaccinated New Zealanders to skip MIQ. So is it time to drop vaccine mandates altogether? To debate this, Royal New Zealand College of GPs Medical Director Dr Brian Betty and epidemiologist Dr Rod Jackson. Good morning, Brian and Rod. Thanks for being with us this morning. Brian, if I can come to you first of all, are we ready to drop mandates?
Oh, look, I think we're starting to see the dip, or we're coming down the downward slide of the peak at the moment. We're seeing that in Auckland, probably the rest of the country over the next 2 to 3 weeks. And I think, yeah, the mandates have done what they've done. I think we need to really start to reset and start to remove the mandates. There's no doubt about that at this point. We need to look ahead at this point in terms of where we're going.
GPs are slammed though, aren't they? Won't that have an impact on your workload, or you don't think it will?
At the moment, GPs are slammed with dealing with the Omicron outbreak. The best thing that can happen here is the number of Omicron cases decrease to free up space to do all that other business that general practice does and to allow access to patients for routine care. We really need to start to move into that space, and the downward trend in numbers is what is going to do that.
Rod, what are the consequences if we were to drop mandates, and who would be most disadvantaged?
Well, look, if you're double boosted, you are, I'm saying double boosted now, I shouldn't say that. If you're boosted, if you're double vaxxed and boosted, you are much less likely to transmit the virus. You are much less likely to have the virus. Where, as Brian says, we're at probably the peak of the Omicron pandemic in New Zealand. I think it's 2, 3, 4 weeks too early to be dropping any of the public health measures that help reduce both the number of infections and the speed at which it spreads. I mean, people talk about mandates. I mean, somehow it's got negative connotation. Public health measures like vaccine passes have been used for decades. Over 100 countries have had vaccine passes in various settings for decades. They're highly effective at actually increasing vaccination numbers, and they've done their job in New Zealand. As Brian said, they've done their job, but it is too early. I think it's 2 to 4 weeks too early to be dropping them. We're not over this yet. And if you look around the world, some countries go up and then come suddenly down. Other countries stay up. And we don't want to be in a yo-yo situation.
Yeah, Brian,
you just need to, yeah.
Brian, has Rod got a point there? Because even the Prime Minister has said, look, we may be over our first peak. That doesn't necessarily mean there's not going to be more to come. And as we've seen overseas, they have had resurgence in cases and different variants.
Oh, look, absolutely. I agree with Rod totally on this. And it all comes down to timing. That's what this is all about. And yeah, there is no doubt over winter we are probably going to see small peaks and surges of Omicron, but we're also going to see flu, possibly whooping cough, possibly RSV, possibly other viral illnesses. So it's going to become a very mixed picture, and we need to free up the system. So it comes down to timing. However, you could see something like the QR codes that we use at the moment to go into things they need to go, but they're probably of very little utility at this point, but it actually comes down to timing. Rod,
we've been hearing that perhaps we've passed the peak in Auckland, but that the rest of the country is in a different situation. If there is a review of the traffic light settings, which we believe there will be this week, would you see it appropriate to have, say, Auckland move into a different setting than the rest of the country? Or do you think that we have to continue at the same traffic light setting countrywide from now on?
Look, it has to be countrywide. People are moving around all over the country. So it makes no sense to do something for Auckland and something else for the rest of the country. You know, we need to keep it simple. As I said, in 2 to 4 weeks, when this current outbreak is largely over, we can do something different. But look, at the moment, actually, I think we should be adding boosters to our vaccine passes, because that's going to make a dramatic difference. I mean, Brian was saying how overwhelmed GPs are. Hospitals are overwhelmed. We are, we're right on the border of losing control. And so we need to keep all of these public health measures in place until we're over it.
So, Rod, if we were to drop these, the mandates and the other public health measures...
We call them passes. I think
passes.
Mandates is bad. It's, it's that Wellington protest that turned what was a positive public health safety pass into something negative. These are not mandates. These are passes. These are safety passes,
right,
like a driver's license.
If we were to drop the passes now, do you feel that we would be letting our most vulnerable down?
Absolutely. Absolutely. Look, our most vulnerable at the moment are the older people and Māori and Pacific and our people who have got multiple other conditions. Now, we know that if you're unvaccinated, you are more than three times likely to transmit the virus to other people. You're more than twice as likely to have it right now. You're more than 5 times as likely to be in hospital right now. So there are lots and lots of good reasons for maintaining our vaccine passes until we're over this major outbreak, which is killing over 250 people a day in Hong Kong. 250. We actually would get to New Zealand's flu, if you do it population, person per person, Hong Kong will get New Zealand's total flu deaths in 3 days. Yeah. And that's with Omicron, and that's because they're unvaccinated.
So much
let's
lower
not take our eye off the ball
over there. It's particularly amongst the older people. Brian, yet amongst all this, there's talk of perhaps reducing isolation periods. So the National Party is calling for 5 days, and we've seen countries overseas do that. Do you think the isolation period should be reduced?
Oh, look, at some point they need to come down. In terms of function and what we're doing at this point, I think there is a strong argument to say that needs to happen. Again, in timings, we're talking about 3-4 weeks in terms of this peak really coming off and then making decisions about what happens at that point. I think there is a strong argument for that. What we have seen as part of the problems in hospitals and general practice is we've had so many staff at home at this point with the isolation periods and what's actually happening. So we need to get back to a point where at some point where COVID is endemic in the community over winter, we are treating these viral illnesses in much the same way as we treat flu every winter and other viral illnesses that we face every winter. And we need to move back into that space.
So when is the appropriate time then to actually remove legal restrictions and say people make their own decisions about when they're unwell, they stay at home? When do we see that in our future? When the health services are coping.
Look, if you see the numbers, if we see the numbers come down in April towards May, which all the modelling is showing, and over May it starts to stabilise at a lot lower rate towards the end of May, then I think that starts to show a time frame where this could start to happen.
Okay, so Brian, yes or no, is the health sector coping right now?
Look, I think it is coping, but just. We are at the peak.
Yeah,
Rod?
Just. I think we're just doing it, and so we do need to keep all of these public health measures in place until we clearly are coping.
Royal New Zealand College of GPs Medical Director Dr. Brian Betty and epidemiologist Dr. Rod Jackson, thank you very much for sharing your insights with us this morning.